Good day, sir. For today's presentation, we are going to discuss drugs that are acceptable to some countries but not to others. The legality of drugs is complicated and divisive topic with wide regional variations. The legal permissibility of drugs in one country may be strictly restricted in another. Owing to varying cultural, legal, and societal viewpoints on the matter, some nations have a more permissive approach, permitting the use of drugs like cannabis or psychedelics for medical or recreational purposes because they believe these substances have therapeutic benefits or a low risk. On the other hand, because of public health, safety, and moral issues, several countries have harsh punishments for both possession and usage. Due to these variations, there is a patchwork of laws across the world which frequently puts people who move between areas with drastically different drug laws at serious legal risk. Navigating the legal landscape requires an understanding of these subtleties.
Another example of a substance that is prohibited in some nations but allowed in others is MDMA, also referred to as ecstasy, methylene dioxymethamphetamine. Recent years have seen the start of clinical trials and pilot programs in nations such as the United States and Israel to investigate the medical potential of MDMA, namely in treatment of post-traumatic stress disorder. The FDA in the United States has even classified MDMA-assisted psychotherapy as a breakthrough therapy, acknowledging its substantial potential in the treatment of severe post-traumatic stress disorder. When used under close medical supervision, MDMA has demonstrated promise in promoting emotional openness and aiding patients in processing traumatic experiences, both of which have significant therapeutic advantages. However, MDMA is still regarded as an illicit drug with a high potential for misuse and no recognized medical use in many other nations, including Australia and Russia. The main issues in these nations are related to its recreational use, which has a number of serious hazards, including the possibility of neurotoxicity, overheating, and dehydration. Strict control measures are prioritized by social and legal system in this place to reduce its misuse and the related hazard to public health.
Psilocybin, the active ingredient in magic mushrooms, is a drug with varying legal statuses worldwide. While it has been decriminalized or legalized for therapeutic use in some countries, it remains illegal in many others. The debate surrounding psilocybin revolves around its potential benefits in treating mental health conditions like anxiety, PTSD, and depression, as well as concerns about its hallucinatory properties and potential psychological risks. The varying legal approaches to psilocybin highlights the complexities of balancing potential harm with potential benefits and offer insights into the intersection of science, law, and culture in drug regulation.
One of the drugs that is illegal or acceptable to other countries but not to others is ketamine. Ketamine is one substance that is permitted in some nations but not in others. Ketamine is lawfully used in medical settings in certain nations such as the United States and Canada, as an anesthetic and more recently as a treatment for severe depression and depression that is resistant to treatment. Since it can be misused and has strong dissociative effects, it is usually provided under close medical supervision in specialized clinics. Ketamine's ability to quickly relieve depressed symptoms in individuals who have not responded to conventional antidepressants is a major factor in its acceptability in these nations. Many in the medical world have praised this as a breakthrough, opening up new paths for mental health treatment. However, ketamine is regarded as a regulated substance in nations like Singapore and Sweden, where it is either completely prohibited or subjected to strict controls. The main causes of this are worries about misuse potential and the negative consequences of using it recreationally, which can include addiction, hallucinations, and cognitive decline. The difference in how different countries handle the trade-off between medical advancement and drug abuse danger can be seen in the way that ketamine's legal status varies. It also draws attention to how cultural beliefs influence drug laws and the continuous discussions concerning the morality of utilizing strong psychoactive drugs in both therapeutic and non-therapeutic settings. Examining the differing legal status of ketamine can help us better understanding international health practices and the difficulties in regulating psychoactive substances. In conclusion, the acceptance and legality of different pharmaceuticals in different nations demonstrate the complex interactions between legal frameworks, health programs, and cultural norms. Some countries have a more lax stance, acknowledging the therapeutic benefits and supporting individual liberty, while others enact strict laws to safeguard public health and preserve societal standards. This discrepancy highlights the significance of cultural context in determining drug policies and necessitates a nuanced conversation when addressing or navigating global drug regulations. Globalization is causing borders to become increasingly hazy, making it more important than ever to have courteous and educated conversations about it. These conversations help to unravel the intricate web of cultural priorities and human values.